Hi everyone. Majority of the topic has been covered, so I'm planning to just go through the general embryology protocol that we follow. We begin with the step-by-step procedure. Once the patient has been recruited, the stimulation begins. Then when the trigger is given, we count it as day -2 because the day of pickup is known as day 0. So we'll start from preparation that starts on day -1. On day -1, first we have to incubate the media based on the number of follicles that are expected. We keep a check on the disposables that will be used on the next day, and we see if something is missing, or probably just ready a whole list of disposables that will be used. Paperwork, of course, is prepared, consent forms, just an estimate. Suppose if there's a frozen embryo transfer, around 5852 is the cost. So whoever wants to know in detail about the costing of the materials can meet me later. I can take that. But for now, that's it. Thank you.